Just a quick refresher, this is one of our study sessions, and they're informal, so there's really no agenda other than to let our guest speaker have her way with us, and then we can ask some Q&A. Feel free to do that however Kris would like to have that done. And at the end of Kris's presentation, we'll have sort of an open discussion about how this work that Kris has been working on can integrate with the Food and Farming Network's work, or what we can do. What I like to do with these is always to end the conversation with what actions can we take as a network to support this work or to integrate it. So that's kind of it. And we'll do some quick updates at the end, but that's really it. And with that, I'll introduce Kris. Kris Thomas, this is your second or third presentation on this now. Fourth, all right.
I shouldn't say that because it might not go so well. You've already done this. Do you want to go ahead and start?
Yeah, why don't you go ahead and start, and that's why we're here, and we'll go with that. I'll spin this around.
Well, thank you so much for inviting me to share with you a little bit about the food security study that my club, the Benzie Sunrise Rotary Club, initiated and has been working on for the past 6 months. And the reason for the study was really to try to gain a little bit better understanding of the food security environment in our 5-county Grand Traverse area, including Antrim, Benzie, Grand Traverse, Kalkaska, and Leon counties, and also to try to identify possibly some new opportunities for collaboration in support of the hunger relief efforts that are going on in our area. And before I go any further, I just wanted to make sure you knew about the other people that have been involved in this study. Besides myself, I had 2 members of my Rotary Club that volunteered their time and expertise to this project. They were Bill Anderson. Bill is a North Sky consultant, and he has helped many nonprofits in our area improve their organizations. And prior to retiring to Northern Michigan, he was the vice president at Hope College, in charge of all their financial dealings, and has led several multi-million-dollar fundraising efforts for the college. So I was very fortunate that he volunteered his time and expertise. We also had Peter Van Noort from my club. He is also a North Sky consultant, and prior to retiring to Northern Michigan, he had led several different energy companies throughout the country. So again, I was very fortunate that they wanted to participate in this project. We also were very fortunate to be awarded a Rotary Charities Program Planning Grant back in May, which allowed us to hire a consultant to help us out this summer. And our consultant was Todd Sanders, and Todd spent some time interviewing some of the pantry staff and volunteers. And he also helped us compile some of the information from some of the surveys that were completed by the pantry workers. We also had 2 people helping us out with the client surveys, and those 2 were Mary Walker, who was in charge of the Antrim County Baby Pantry, and also my husband Cecil helped too do some of the client interviews. And so with their support, we were able to really keep this project on track. And I also wanted to mention the Northwest Food Coalition and Val Stone. Val, I don't know if you know Val, but if it wasn't for Val Stone and the coalition, we would have never been able to do this study. They were very supportive of us, and are very cooperative with us, so we were very, very fortunate with that. And also, I just wanted to mention one thing, because I've seen this a few times and I've heard it, and I want to make sure everybody understands. And it was kind of in your email. I wanted everybody to know that we didn't actually do this study for Rotary Charities. That we are, and I know I've seen myself referred to as a Rotary Charities researcher. Not true. I'm not a Rotary Charities researcher. I'm not tied to North Sky or anything like that. This was really just my Rotary Club wanted to do this for the community, and it really came about because Al Boni, who is here with us today, he is our district governor for Rotary, for our district. And our district includes 60 clubs. It spans from Holland into Canada. And he had asked me a while back if I would help him while he was, during his year as district governor, if I would help him implement a district-wide project that had to do with food security. And really what he wanted to do is get all 60 clubs to do something in their own communities to address food security and hunger. And because of that, because I had no background on this, I needed to research it and try to understand it better. And it's because of that I learned about a study that was done somewhere else and thought maybe it would be valuable here. So this Rotary Charities has been extremely supportive of this project. Marcia Smith has been great. She has allowed us to use their office space to have meetings. She attended a meeting back in March to kind of kick this whole thing off. And she's been very supportive and enthusiastic about the project. And I'll talk more about that at the end. So Next, what I'd like to do is just share with you a little bit about the methodology that we used for the study. And just to make sure that we're all kind of speaking the same language when it comes to food security, there's two different types that I'm going to be talking about today. One is individual food security, which is a term used to describe a person's confidence in knowing that they will have enough healthy, nutritious food to feed themselves and their household. And the second is community food security, which is a condition in which all community residents obtain safe, culturally appropriate, nutritionally sound diet through an economically and environmentally sustainable food system that promotes community self-reliance. And the model for our study was a food security study that was performed by food gatherers in Ann Arbor. And food gatherers, they're a food bank, and they're part of Feeding America. And their mission is to alleviate hunger and eliminate its causes in Washington County. And they really do serve as kind of like a lead entity for hunger relief in their county. And for our study, we work with the Northwest Food Coalition, whose members are the pantries and emergency meal sites in our 5-county region. And we asked them to complete a survey for us. And just to help us try to get some background information about their operation, and also to get their thoughts on opportunities for new opportunities for collaboration. And the survey that they completed looked very much like the one the food gatherers created for their study, but we did add some things to the survey, just some additional things that we wanted to get some information. And the survey focused on identification of individuals and families that are food insecure, food collection methods, food distribution, and other services offered by the members. And 52 of the 57 coalition members returned the survey to us. We also interviewed clients that visit pantries and emergency meal sites, and we used the survey that was created by food gatherers for their study. And the biggest difference in our work compared to what they did is they did all of their surveys in one county, Washington County, and we did our surveys in the 5-county region. Also, they did 75% of their surveys they did in writing, and the other 25% they did on one-on-one interviews. We did all of ours using the one-on-one interview method, and we ended up doing 521 survey interviews by making 48 visits to 21 different pantries and meal sites. And I'm really very glad now that even though it was kind of a time-consuming process to do that and added a little bit of time onto the project, I'm so glad that we had to do it that way, because I think we really were able to gain a much greater understanding of what's going on in our community, because people were concerned about us doing it this way because they didn't think their clients would want to talk to us. But they did want to talk to us. They wanted to share their stories because they want the situation to get better. So I think it ended up being a very good thing that we had to do it this way. And their survey focused on food purchasing, level of individual food security, use of available food assistance programs, and information about their households. And in addition to the surveys, we tried to reach out to as many people in our area that have anything to do with food security, hunger relief, that sort of thing, to make sure that we were trying to get the best picture we could of what was going on in our community and have people share with us the stuff that they're working on. And we also reviewed local statistics pertaining to poverty, and we did a review of national best practices related to building both individual and community food security. So next, I'm going to share with you 3 things I now think about every day because of this project. And the first one is an objective of the Food Farming Network, which is by 2020, 100% of Northwest Michigan residents will have access to ample, high-quality, healthy, and culturally diverse diet, 20% of which comes from the region. And the reason I think about this every day is because when I first learned of the Food and Farming Network this past summer and spent some time on your website, I was really amazed at everything that was going on in the community. And I saw the goal and objectives, and I thought they were just great. But this one stood out to me because I thought, how on earth are they going to do this? And the second thing I think about every day is that in Leelanau County, which is the county experiencing the least amount of poverty in our 5-county area that we studied, and whose pantries offer very generous quantities of food and allow their clients to visit on a very frequent basis, it was identified through Leelanau Christian Neighbors Blessings in a Backpack program that nearly 10% of the children in the county were not receiving adequate quantities of food on the weekends when school was in session. And the reasons why this is happening, we don't know. We don't know what's happening with these children when school's not in session, and a similar review has not been done in the other 4 counties. And the third thing I think about every day is the client survey interview that I did. And this was at a pantry. It's a very nice pantry. You go in, they have tables and chairs set up, very welcoming. You can sit down and visit with your neighbors. They always have coffee and sweets, cookies, donuts, cakes, and stuff available for people to enjoy while they're waiting to go into the pantry. And this particular client was a gentleman. He told me he was 49, And he came into the interview room and he had a plate, and on the plate he had 1.5 large cookies. And he sat down, and very early on in the interview, he just said to me, "Did you happen to notice that very large man out in the waiting area?" And I said, "Yeah, I saw him." And he said, well, 2 years ago, I used to be that size. And then he went on to say that 2 months ago, he went to the doctor and he weighed 220. And I looked at him and I said, "You don't weigh 220, because there was no way he weighed that much." And he said, "You're right." He said, "I was at the doctor yesterday and I weighed 190. And then he went on to tell me that he was a severe diabetic, and because of his diabetes, he was not able to work. And then he looked at those cookies and he said, "And I know I shouldn't be eating those." But I knew I was eating the cookies. I mean, he was hungry, and that was the food that he had access to. Well, later on in the interview, when we were talking about household composition, he shared with me that he was married and that his wife worked full time, but that he also had living in his household was his sister and her 3 children. And the reason they were there was because his sister had fallen on the hard times and had acquired a lot of debt. And he had invited them to move in with he and his wife so that they could try to work towards paying off, she could work towards paying off that debt. She was living with them for free. And hopefully she would be able to have a place of her own again. Well, at the end of the interview, I shook his hand and I thanked him. And then he gave me a hug and he thanked me. And then he took that plate of cookies and he threw them in the trash and he went over to the pantry to get his food. And the reason I think about this particular interview every day is not only because it was one of the many heartbreaking interviews that I did over the past 3 months, but because I really think it shows a lot of what's going on in the lives of some of our neighbors. So one thing we learned right away when we started the study is that there's an incredible number of tremendous programs that are being implemented in our area to address both community and individual food security. And the people that are doing the work are some of the most passionate and dedicated people that I've ever met. So it was pretty easy for us to come to the conclusion early on that the resources exist in our 5-county Grand Traverse area to create a food secure community which provides for individual food security for all of our neighbors. And although the primary focus of our study was on individual food security, I want to start by briefly touching upon community food security, because the vibrancy of a local food system clearly affects the ability of a community to meet the food needs of its low-income residents. And so in order to achieve individual food security for all of our neighbors, I'm convinced that we do have to create a food secure community. And thanks to the efforts of all of you and many others, I think that the community is well on its way to doing that. And to me, one of the best ways to illustrate how the community is working together on this is through the Food Farming Network, which, as you know, but I'll say it because there's some that are part of the network, it was created back in 2009 to provide a forum and opportunity for the region's many food and farming interests to link and advance their work. And the network has an extensive list of partners, including the Michigan Land Use Institute, MSU, Cherry Capital Foods, land conservancies, farmers, businesses, health departments, colleges, Munson Medical Center, and many more. And the network established a goal. By the year 2020, the region's food and farming systems will be more resilient and provide at least 20% of our region's food. And most of the objectives associated with this goal are tied pretty closely, I think, to the work that's being done by the network partners. However, there's that one objective that appears to expand beyond the work being done by the partners, and that's the one that I already mentioned, that by the year 2020, 100% of Northwest Michigan residents will have access to ample, high-quality, healthy, and culturally diverse diet, 20% of which comes from the region. And we believe that in order to be able to really achieve this objective, that members of the network are going to have to reach outside the network and collaborate with organizations that are directly involved with hunger relief and individual food security, such as the Northwest Food Coalition. And one of the reasons we believe this is that what we learned during the study is that only 31% of area pantries offer produce to their clients from local farms. And the amount of produce either donated or purchased from local farmers represents only a very, very small percentage of the food that's available to the clients. And the vast majority of low-income residents visiting area pantries do not visit farmers markets or produce stands because the food at these outlets is too expensive for them to purchase. And most of them don't even eat the recommended number of fruits and vegetables every day because they can't afford to purchase it in the stores either. So we just think that this is going to be one area where there's probably going to be some opportunities for collaboration in order to meet that objective. Next, I'd like to share with you some insights that we gained on individual food security. And what I'm going to try to do is give you a picture of pantry customers themselves, their access to healthy food, and then a bit about pantry capacity. First, I'm sure Many of you are familiar with local statistics that indicate that roughly 23,000 or 14% of our neighbors in the five-county Grand Traverse area live in poverty. And as concerning as this number is, it really doesn't tell the whole story. And because earning a wage above the poverty line does not mean that an individual's income is sufficient in order to support a healthy lifestyle for themselves and their family. And to illustrate this point, for parents with 2 children living in Grand Traverse County, a living wage, which is the hourly rate an individual must earn to support a family, is $22.86. And at the same time, this parent would have to earn $8.80 an hour or less to be considered to be living in poverty. And what happens with when people obtain employment where their wages fall between the poverty line and the living wage line? Well, some have told us during the interviews that the benefits that they received previously, such as assistance for healthcare and food, have either been reduced or eliminated. And with money tight, most choose to pay the bills that they need to pay in order to keep a roof over their head, leaving very little money at the end of the day to buy food for themselves and their families. And when they look outside for food assistance in our community, limited pantry hours makes it difficult for many to access the food available to them. And when they are able to visit pantries, the amount of food and types of food available to them varies greatly by county of residence and by pantry, the day of the week that they actually can visit a pantry, and even the time of day that they can make it to a pantry. So I just wanted to make sure that everybody understood, because I know it's not something I understood. You always hear hunger and poverty, and how those two go together. But to me, that's really minimizing the issue, that it's really much, much greater than poverty. It's really could affect a lot of people that just aren't earning a living wage. And to give you a glimpse inside some of our client interviews, I just wanted to share with you a few statements that were made by pantry clients regarding their own food situation. One woman told me, "My kids fill up on ramen noodles because I can't afford the milk and butter needed to make macaroni and cheese. I hate that I can't provide healthy food for my family." A gentleman in his 30s said, "My kids love fruit, but I can't afford to provide it for them. I'm hoping that I'll be able to buy 2 bushels of apples this fall to have fruit available for them this winter." A woman in her 50s said, "Even though I'm severely overweight, I am hungry at times because sometimes I just get sick of eating ramen noodles and hot dogs." And a young mother told me, "I can fill up on coffee." She said, "I just need to make sure there's enough food for the kids." And I also wanted to share with you some of the thoughts that were made by Northwest Food Coalition members on their surveys. The first is, many people in our community are genuinely surprised when they learn of the need that exists in the community and respond, "I had no idea. I really don't know how to spread the word." We need fresh food, period. No more prepackaged obesity-causing foods. We miss Fresh Food Partnership and the fresh produce they've provided in the summer. We need more fresh produce weekly and less expensive products to purchase. Prices just keep going up. And the final one is, I have no idea how many people are truly food insecure and experience hunger. Well, we learned during the study that roughly 72% of the clients that we interviewed are food insecure, and that 36% of the individuals we interviewed live in households having the most severe condition of very low food security, which means that the eating patterns of one or more household members were disrupted and their food intake reduced at least sometime during the year because they couldn't afford enough food. Pantry clients shared with us several barriers that they believe exist that prevents individuals and families from being food secure, with the lack of information on available resources, lack of adequate pantry hours, and lack of transportation being the 3 most often cited. We learned that many people in our community who are food insecure suffer serious health issues, with diabetes being the issue most often discussed by neighbors visiting pantries. We learned that 36% of clients interviewing visiting pantries or meal sites reside in households comprised of more than 2 generations of family members, or households that included extended family members and friends, just to make ends meet. And client reliance on food pantries is long-term. 4 out of 5 respondents indicated they receive food from 1 or more pantries on a regular basis. Only 20% of people told us that they use the pantries as an emergency source or a short-term source of food. We learned that the greater number of pantries clients have access to, the greater number of pantries they tend to visit. In Grand Traverse County, the county which has the largest number of pantries available to residents, 38% of pantry clients visit 2 pantries on a regular basis, and 18% visit 3 or more. So more than half the clients that visit pantries visit at least 2 pantries or more. And however, if you look at Antrim County, which have fewer pantries available to their residents and they're spread farther apart, only 25% of pantry clients visit 2 pantries and only 2% visit 3 or more. We also learned that the number of visits allowed to a pantry each month varies greatly throughout the 5-county area, and the philosophy behind the quantity of food distributed during each visit also varies. For example, the major pantries in Antrim and Kalkaska County, they allow their clients to visit their pantry once a month, whereas we found one pantry, at least one pantry in Grand Traverse County, that allows clients to visit twice a week. We learned that just over half of the pantry meal site clients receive benefits under the Bridge Card program. And however, for households using a Bridge Card, the majority have experienced cuts in benefits in recent months. And benefits for the vast majority of pantry and meal site clients is well below the average per household member benefit in the Grand Traverse area. Pantry clients, in general, are very thrifty. Almost 2/3 of clients visiting pantries and meal sites shop at outlets that they identify as offering the lowest food prices, with 38% shopping at the outlet that is most convenient to them. Only 20% of the people that we spoke to said that they include best selection or the highest quality of food was a factor in determining where they did their grocery shopping. And although 80% indicated that they were very or somewhat satisfied with the price of fresh produce at their primary grocery store, almost 60% ate less than the recommended 5 or more servings of fruits and vegetables each day because they were too expensive, and 2/3 of the clients rarely or never purchased produce from a farmer's market or produce stand because it was either too expensive or just too expensive to get there. We learned that only 20% of clients receiving Bridge Card program benefits participated in the Double Up Food Box program, and 52% didn't participate because they weren't familiar with the program. And we learned that the program is offered in 10 farmers markets throughout the 5-county area, 2 in Grand Traverse County, 2 in Benzie, and 6 in Leelanau County. And not too surprising is that we learned that the program is used much greater in Leelanau County than the other counties at 54%. And I'd also like to share that of the 5 counties, the number of residents that actually receive Bridge Card benefits and would be eligible for the program is by far the lowest in Leelanau County at 6.7%. And at the other end of the spectrum, in Kalkaska County, where there are no participating farmers markets, almost 20% of residents are covered by a Bridge Card who would be eligible for the program. In addition, almost 1/3 of clients indicated they never purchased food from a restaurant, including fast food restaurants, while almost half indicated purchases were made only once or twice a month because they couldn't afford to eat out. And finally, 3/4 of clients indicated that when first faced with the need for food assistance, they learned about available resources from a friend, relative, or word of mouth. Clients find it difficult to identify assistance that's available in the community and believe that some people are not getting the help that they need simply because they don't know it's available. That's the right one. Okay. Next, I just wanted to share with you a few things that we learned from the Northwest Food Coalition members on their survey related to their thoughts on increased collaboration within themselves with other organizations in the area. First, half of the pantries and meal sites see value in collaborating to purchase food and other products for clients. And information provided by just 25 of the 57 pantries and meal sites revealed that they spent combined over $1.1 million on purchases in 2013. Almost 3/4 of pantries would like to see increased collaboration with regard to cash and food drives. The majority of Northwest Food Coalition members would like to see increased collaboration and communication, not only among members of the coalition, but with organizations that promote food security. And 2/3 of coalition members would support expansion of the coalition or identification of another lead entity for hunger relief efforts in the Grand Traverse area, while over 80% believe that developing a food security plan for our 5-county area would improve individual food security. And to me, what is great is that 3/4 of the coalition members told us that they would like to actively participate in the development and implementation of any changes that were planned for the future. And finally, the type of qualifying information requested from clients prior to obtaining food really does vary greatly between pantries. And as a result, analysis of any significance really cannot be done with the information that's currently being collected. Next, I'm just going to share with you some thoughts that are in the report regarding opportunities for action and increased collaboration. And I've broken it down into 3 areas. The first 2 are kind of more of a big picture opportunities, and then the second one has to do with opportunities for identification of neighbors in need of assistance, and also then opportunities for collection and distribution of healthy foods. First, big picture, we believe that establishing a food security council for the 5-county region to develop a food security plan and advise on its implementation would be of great value to our area. And with a council made up of people and organizations that are working to address individual and food security and community food security, we think that the plan could be developed that would provide the framework needed to achieve individual and community food security. And to me, starting with the food farming networks, overall goal and supporting objectives really could be the starting point to developing such a plan. And obviously there are already tons of great things that are being done in our community to support both individual and community food security, like the Michigan Land Use Institute implementation of the Double Up Food Bucks program, the 10 cents a meal program for students, Goodwill's Farm to Freezer program, and the Food Rescue program, and all the great work that's being done by the coalition. But we still feel that having a council and the actual food security plan really could provide the structure needed to achieve the goals of the community. We also believe that identifying a lead entity from the Food Security Council to address food security in the Grand Traverse area, whose mission would include implementation of the food security plan, is needed. Next, I'd like to share with you some thoughts that we had on identification of neighbors needing food assistance. First, we believe that providing expanded support to the Northwest Food Coalition really would allow for greater community awareness of pantries and meal sites and support for them. And developing a plan with specific goals for the coalition, as well as developing a website and promotional materials, could be very valuable. We also think that developing a standardized method for members to collect data would support analysis needed to monitor and improve individual food security. We believe that developing a partnership among organizations in the Grand Traverse area to aid in the identification of food insecure neighbors in our communities would be of value. And a collaboration among hunger relief organizations, the medical community, schools, senior centers, and religious communities to work together to identify and reach out to our neighbors in need really could benefit the area. And we believe that a collaborative effort to develop a regional blessings and backpack program that could benefit from joint marketing and organizational efforts could be of value. And that this would support uniform implementation of the program to help ensure that all area residents, all area students in need are identified and provided for. And with this said, even though I think the programs that are being created in our area are very, very important and they're really serving a need that exists right now, I really do hope that someday that we don't have to have these kind of programs, because I just haven't been able to convince myself that this is the best way to be able to be fighting childhood hunger. Next, I'm going to share with you some thoughts we had on collection and distribution of healthy and nutritious foods. We believe that developing a system to work with the farming community to provide for the purchase and gleaning of fruits, vegetables, and proteins from area farms for distribution to food insecure families in our area would be of value. We believe offering the Double Up Food Bucks program in at least one farmer's market in every community would be worthwhile, and that working towards integrating the program in community grocery stores would be ideal. We think that consideration should be given to expanding the farm to freezer program to support area pantries, and encouraging community and church gardens to support those in need, and promoting fresh produce donations instead of canned produce donations might be worthwhile. And encouraging cash donations instead of food donations to support the purchase of locally grown food for distribution at pantries and meal sites could help both individual and community food security. And we believe that creating a farmer's market at area schools or other community-based locations which operate on a pay-if-you-can basis might be worth pursuing. And we think that a more aggressive promotion of protein donations could be of value, and consideration should be made to working to try to get additional local meat processors to acquire a license to participate in the Sports Food Against Hunger campaign, and to providing financial support for the processing of deer. And coordinating fishing tournaments with catch, cleaned, and donate to pantries and meal sites, and promoting donations of other proteins such as ducks and turkeys might help. And more aggressive promotion of the purchase and donation of proteins from the county fair where pantries might be of value too. And we believe that developing and implementing a collective purchasing program for area pantries and emergency meal sites would be of value. And we believe that consideration should be given to expanding the food rescue program to encourage partners to donate a wider range of food items. We believe that a review should be performed of existing pantry practices and procedures, and adjustments made as needed to provide greater support of our neighbors in need, and that this review should include as a minimum hours of operation and procedures for food distribution. And we think that the benefits of establishing mobile food pantries or grocery delivery program to provide greater access of food for all of our neighbors should be considered. And finally, there's just one more thing that I wanted to share with you that I think about every day now because of the study. And it is something that Brandon Sang said to me way back on February 27th when I met him for the first time in a meeting. And at the end of the meeting, I just threw out the idea of, said, what would you think if we did a food security study in our area? And one of the things Brandon said to me, and this isn't an exact quote or anything, but he said something like, what I want is for our area to become the model in the country for how to deal with hunger and food security. And after spending all of about 2 seconds with Brandon saying, and meeting all of you that are working on this effort and so many others in our community, I was absolutely 100% believe that the people in our community that are dedicating their lives to create a food secure community that supports individual food security, and the people that are dedicating their lives to feeding our hungry neighbors really can work together to create this model that others are definitely going to want to emulate. So that's how it was pretty easy for us to come to the conclusion early on that the resources exist in our 5-county Grand Traverse area to create a food secure community that provides for individual food security for all of our neighbors. So that's what I had today. Again, I want to thank everybody who took the time to meet with us and support us on this project. And we hope that maybe some of the information contained in the report will be of value to your work. As I said all along, my team is certainly available to help in any efforts that you would like us to help on if you want to move forward. And I also said that I was planning to have a meeting in January. We've got the meeting set up. It's on January 7th to try to get people together to discuss the issue and to see what actions they would like to take to move forward. And one great thing about this is that, like I mentioned at the beginning, is that Marcia Smith and Rotary Charities have been very supportive and very enthusiastic about this project all along. And they would like to, at this point, become very involved with the project and are going to be providing a vision facilitator at that meeting and to try to move things forward. So I think that is great. They've got the resources certainly available, that they want to offer their resources to the community of this project. So anyway, so that's all I have. So if you have any questions for me.
Well, let's hear it for Kris.